Fifth metatarsal fracture. The fifth metatarsal is located on the lateral side of the foot and is highly prone to injury. The distinctive part located close to the tarsal bones is called the proximal portion, which is divided into three parts. The tuberosity, which is the bony projection that can be felt on the outer side of the foot, the metaphysis, and the proximal diaphysis. There are different fracture types that could occur in this area, which pose an important diagnostic challenge, where a slight difference of the injury location can lead to a vastly different prognosis and treatment plan. A suboptimal treatment regimen can cause delayed union, re-injury, and disability. Tuberosity avulsion fracture, also known as ballerina fracture, is where the foot and ankle are twisted downward and inward, and a tendon that attaches to the base of the fifth metatarsal may stretch and pull a fragment of the bone away from the base. This type of injury is called an avulsion fracture. Jones fractures, named after Sir Robert Jones, who first described them a century ago, are fractures at the base or at the shaft of the bone, which are prone to difficulties in healing due to the poor blood supply to the area. The clinical presentation of fifth metatarsal fractures ranges from feeling of a sprained ankle to complaints of severe pain on the lateral side of the foot, sometimes with difficulties bearing weight, and may have surrounding swelling. All depends on the type and location of the fracture. Standard foot x-rays should be obtained. The treatment options may vary according with the fracture type and location, ranging from the conservative option based on non-weight bearing immobilization and suppurative measures such as rest, ice, elevation, and anti-inflammatory drugs, to the more definitive treatment options, which is a surgical repair.